the cardiovascular system, the respiratory system, the cardiovascular system, the respiratory system. We look at the gastrointestinal system. Then we go to, just take the body that way. From the cardiovascular, you go to the respiratory, abdominal system. You're going to look about that. Then we look at the genitourinary system, and we can also look at the endocrine system. We are going to manage conditions. So over here, like I said, I'm going to, if I get all your list, I'm going to group you, okay? And when I group you, uh, I'll give you topics for you to learn around them. Meaning that those topics, we are not going to treat it as I'm not going to treat them. You are going to prepare notes on it, notes on them. Mr. Tete, please mute yourself. Tete Emmanuel. All right. Can you hear me? Am I audible enough for you guys?
Yes, sir. You
Yes,
can
sir,
hear
loud
me.
and clear.
All right. Zuzu, I've seen that. Yeah. So I'm saying that we are going to have a group work so that some of the conditions that, I mean, we can't treat them here because of time, because some of the topics will take two days or some maximum 3 days to finish the topic. Because we need to, know much about it, and there will be questions up and there. There's going to be discussions. There's going to be scenarios. There's going to be observations that you guys have had, and some questions. So because of that, it elongates our time, and sometimes we are not able to finish. I'm telling you this from experience I had from the previous classes. So this is what we're going to do. There are some of the topics that I'm going to give it to you as reading assignments. So you read around them. You can meet, not from this, you can meet as a group. Find a day and meet as a group and discuss it. So that when you come here, one of you would just give us what, or wash us around it. When we say washing, you are washing in medical term. When we say washing, we mean that you are coming to teach us. What you know about it. Uh-huh. So one of you will watch us about whatever that you guys have talked about. So I'm going to give you I'll give you the topics. I'll put them in your page. Okay. I'll work on them and put them in your page. But then and also the ones that we will be treating. So every day, every week, the topic that we are going to treat or wherever we have gotten to, you'll be pre-informed so that at least you will read something about it, or you come with a case, you come with what? With an example or with an incident. The reason why I'm happy because you are all practitioners is that you are going to give me observations. You are going to give me case scenarios of people who came to your facility. You are going to give me instances of, experiences. And those ones are going to better our class, are going to better our discussions, and we will understand them more. And yeah, and I'll be glad if you come with questions, because there are a lot of things that uh, most of our herbal doctors, now you guys, you are enlightened, you know more. But most of our herbal doctors who are out there who don't want to seek education, or who are not willing to seek better themselves, they give meanings to certain things, and sometimes you'll be there, you'll be laughing, because what the person is saying is totally different from the right or from the truth. Yeah. So you that you are practicing now, I'm very happy that most of you, about 90% of you are practicing. And that is the best. That is actually a positive sign for me. Like I said, we are going to have our midterm maybe on the fourth, by the fourth week. No, that is our assessment, first assessment by the fourth week. I will find a way of, making it online so that when you just log in, I'll see the IT guys, then we'll do that. We'll just log in, do it, then you submit. You log in, do it, then you submit. Then I'll get the results, then I'll record for you. Because it would not be in person. The one that will be in person will be maybe the midterm. Yeah, that one, I think that one is in person. Yeah. What again? What again? What again? Yes, I think that is it. So without wasting much time, we are closing at by 5:30. We should close. So let me let me give you some 2 minutes break while we start the topic for today. We're going to talk about internal medicine. Let me share the slide. Oh,
Dr. Eduah?
yes,
Yes, Kadish again from Jamaica. About
right.
that mid-semester exam in person, is there a special thing for us here in the diaspora? Or will that be arranged for us to do our mid-semester?
I think there's that, yes, there's that possibility. Yes, I'll speak with Prof, and I think that one can be done. Yes, there's something around. It's anything can be done online. It's no problem. Okay, you don't really have to come down for mid semester exams. I'm not sure of that, but I think there's a way out. So once as we're able to do the interim exam, the assessments via online, we can do that too. Okay, so no worries. Okay,
Thank you.
you're welcome. Give me 1 second. Let me share my screen. Yeah. A moment, please. Yeah. Okay. Yeah. So let's continue. Permit me for the glitches. This, I mean, I'm still in working hours. Just that the clinic is less busy. So yeah. So when we talk about internal medicine, we are going to read about internal medicine. When we talk about internal medicine, we're saying that internal medicine is what we mostly practice in Ghana. That is the general type, the general medicine we practice in Ghana. You go to the hospital. It is the commonest in Ghana, the commonest of the medicines that we practice. When you talk about the specialties, the medicine specialties, we have we have the various specialties. We have surgery, we have optometry, we have how do you call it? Psychiatry. When you go to the hospital, we have all these areas, and we also have the internal medicine, mostly where we have the male ward and female ward. You understand? Those ones are those focus. They mostly focus on the internal medicine. So when we talk about internal medicine, most of our conditions that we have in Ghana are mostly internal medicine conditions. So then comes what is internal medicine. So we have two types. We have the type of medicine. We have the internal medicine. Then we have the family medicine. We have internal medicine and family medicine. But internal medicine is talking about mostly focusing on what? On the internal organs. Okay, we say internal medicine. So kidney disease, liver disease, how do you call it? Endocrine diseases, CVA conditions, how do you call it? Neurological, nervous system, all the systems in the body. When we are talking about that, we are talking about any conditions around as we are studying about them, they are hot. Basically, they form the internal medicine. So you say internal medicine is a medical specialist focused on comprehensive care of adult patients. It involves prevention, diagnosis, treatment, that disease affecting internal organ systems. So you see, so it focuses on
Hello,
what
please.
disease.
Sorry for interrupting. The screen is a little small. Can you enlarge it more?
Oh, okay. Let me work on that. Oh God.
Can you mute your mic?
It- Now, okay. Yeah.
Is it better now? Is it better now? Hey, okay. The one who asked for the enlargement. Is it better now?
No, sir. No, sir. You go back to the.
Yes.
Is it better now, please?
No,
Yes.
sir.
Yes, yes,
Oh,
you can.
Yeah. Now,
Sir, it's
okay.
better. Please, I would advise everybody we can zoom in. You can zoom in the picture and then you see it well.
let's zoom in as she's saying. Because even if I enlarge it here, it is still the same
Sir,
as okay.
please, even I can't see the screen.
Hey, really?
Yes, sir. Okay.
Is it better now?
Yes, please.
All right, so that's it. So basically, when we talk about internal medicine, we are talking about what? The systems: cardiovascular system, respiratory system, gastrointestinal, renal, endocrine. When we talk about internal medicine is focusing on, like, somebody has come to the hospital. Let's diagnose the person. What are the labs that need to be done? What are the treatment that need to be done? What are the investigations? Should this person be referred? Should this person see a specialist? Should this person go into surgery? Should this person go for dietary therapy? Should this person go for psychiatry therapy? Should this person internal medicine does that? So internal medicine focus mainly when you talk about internal medicine, you're talking about adults. When we talk about children, we are talking about pediatrics. We say pediatrics. But when we talk about internal medicine, it's mainly when you go to the hospital, we classify adults who have internal condition problems. You understand? How do you call it? Internal organ problems. We classify them under what? Under internal medicine. So that is what you are going to study. So we are going to be studying conditions like hypertension, heart failure, diabetes, myocardial infarction, liver disease, kidney disease. I mean, chronic liver disease, chronic kidney disease, stroke. You understand? I mean, the conditions that are in our day-to-day activity, I mean, in our setting in Ghana, that's what we are going to focus on. And we are going to be more practical with conditions that will come to your facility. Because you believe with me that mostly you have hypertension patients coming, right? You have diabetes patients coming. You have then you have the general one, the malaria, the typhoid, the ulcer. We are going to look at all those ones. So that is what internal medicine. So it also focuses on what hematological and this thing. If you press, it goes back. So hematological, blood-related conditions, infectious diseases, like I said, malaria and all those, and tuberculosis, pneumonia, autoimmune disorders are all there. They all focus on internal medicine. Physicians trained in internal medicine are called internists. They manage acute and chronic illnesses, often serving as primary care doctors for adults, but can also specialize in fields like cardiology, nephrology, gastroenterology. So, as part of the course, maybe you can be a naturopath who will specialize. I'm sure that will come. I think I even saw it. Naturopaths who specialize in gastroenterology, naturopaths who specialize in cardiology, and naturopaths who specialize in let's say nephrology. You understand? So as you are learning internal medicine, you're going to learn about all these ones. Then you can decide that, oh, let me specialize in what? In cardiology to focus on the heart. Let me specialize in nephrology to focus on the heart, on the kidneys. Let me specialize in hepatology, gastroenterology or hepatology to focus on what? On the liver. You understand? You pick one organ and you focus on it and go and delve into it as a naturopath. So once as this course is possible, it is also possible outside there to go and specialize. I don't know if it's in Ghana, but it's possible, yes. So let that one also be your dream, so that we can have a naturopath who is specialized in cardiology. That we know that if the hospital one is not helping, if they come to so and so prophet Dr. Mark Williams Herbal Center, he specialized in what? In cardiology. Mr. William, is your hand up?
No, sir.
Yes, please. Yes. I don't know. I don't want to cut you short. I don't want to sound offensive. But I'm wondering if we are supposed to be holistic practitioners in the idea of naturopathic holism. Is it imperative or is it accepted that we branch into these specializations? Because the whole idea of holism is to treat as a whole, not in part, not per specialities, but we could specify as and when. So
Oh
that is
yes,
just
your
my
treatment.
stuff. Yeah.
Okay, I get you. I get you. You know, in Ghana, if you are a medical practitioner, you are our almost. I mean, almost we are. I mean, in a whole. I mean, you see all cases, but then some go to specialize. So it's possible on your side too. It will surprise you that some years to come you will see that there is a specialty. Or you don't get what I'm saying. We all learn general. I'm a general practitioner. I'm talking. I do general. A time will come, you see that I'm a surgeon. You get it?
Okay. Doc, let me come in and address him. In fact, even in the US and other jurisdictions, you see naturopathic doctors who are specialized in different fields. For instance, I did naturopathic urology. So even in the outside world, you see naturopathic gynecologists, naturopathic dermatologists. They are all over. And we have developed even a program for it. So
Yeah,
the
so
fact
that
that
is it.
you are naturopath, the fact that you are naturopath doesn't mean yes, it's holism, but that doesn't mean that you can't specialize. You can specialize and also practice holism in your specialty.
That's good. That's good. That's a good one there, Prof.
Okay, thank you very much.
Yeah. So for me myself, I love to cut. So in some few times, some few years, you see that I'm cutting. I'll be cutting. Because we have to branch. So you as a that's what I'm saying that in some few years to come, we'll have Prophet Dr. Mark your name, who is specialized in oncology or who is specialized in cardiology. Then we'll say that if you want a naturopath who is special, if it's about heart, go to this man. That is what we want. If you have who is about your urology, is about your prostate and those things, go to Dr. Zuzu's hospital. You understand? That is what we want. So that, I mean, naturopath will also be out there. Because believe you me, these naturopaths, I mean, all these are the ones that we give, the drugs that we give. Like when I say me, I mean we the orthodox ones. The ones that we give, most of them come from the naturopath side or the herbal side. So if you come out and you are well pronounced, I mean you've made your things right, well established, you get referrals. If you get referrals and they are good, the final goal is what? Is the healing. You understand? The healing is what we are looking out for, not any other thing else. The healing. Yeah. So I'm looking up to that one. So don't end it here. I'm just making you know that you shouldn't end your naturopathic journey here. As a naturopath, you don't end here. You can still go further. Mr. William, is your hand up again?
Yes, please. I'd like to ask a question. I don't know. Please, was it Prof who answered my question?
I'm sure.
Okay,
Yes,
okay,
yes,
then, okay, Prof. Thank you very much.
yes.
My
In
question has
fact,
to do
in
with,
fact, I did. Let me tell you something. In fact, I even did MSc prostate cancer care, Chef Hallam University. You see,
Okay.
so you can have yes, even in Sheffield Hallam University UK, develop standalone program. So you can even pick MSc prostate cancer. It's about 13. I think about 2015 credits. Yes, where we look even at holistic treatments, complementary therapies, and all. In fact, it was even in the MSc prostate cancer care Sheffield Hallam University program that I developed more interest in complementary therapies and holistic medicine before I went to Lanaka City, Cyprus.
Oh,
That's my
okay.
holistic natural medicine journey.
Oh, okay. That's a good one. We are glad you are on the class. At least it will make us have more enlightenment and also the zeal to go higher. I'm very much happy that this our class. We have a lot of practitioners on it. We have most of you, about 90% of you are practitioners, and so you are going to it's going to help us a lot, and it also make us know that at least it will make us know that now we have when we are referring or when a client comes to our facility and tells us that he went to a herbal doctor, he went to a herbal place, and I know that you are the one there. I wouldn't. I mean, I wouldn't fear because I know he has gone to a hand, I mean, a qualified hands. You get what I'm saying, what I'm talking about. But sometimes they come from somewhere whereby they don't even give prescription. They give them drink this, drink. Those ones we don't want them at all. So I'm happy most of you, about 90% of you here are practitioners. So as we study along, we are going to help, we are going to heal a lot of people in Ghana. Yeah, so let's continue. So that is internal medicine. That is, we are going to focus on all the internal organs. And as I said, most of them,
I,
we are going to
I
talk
didn't
about.
ask my question, sir.
Hey, your question? What question? What's the question? Uh-huh.
Yes, my question was that if you should specialize as a naturopathic doctor, I know that a couple of people can transit from being a naturopathic doctor to become a GP. I think there's that kind of arrangement. So my question has to do with: is it possible for one to pursue a GP career at the same time, a naturopathic speciality? Is it possible in any way, and is it acceptable? That is my question.
In the
From
US,
my
in North
experience,
America,
from what I've seen from Prof's portfolio, everything is possible.
oh
Do you get
yeah,
what I'm
no,
saying?
in fact, even in the US, it's in the US. It is
Yes.
especially US naturopathy is highly regulated. The jurisdictions where naturopathy is highly regulated, they have different modalities. In fact, even in Bastille and other highly regulated colleges, you can even be pursuing ND.
Oh, it's just an added something. Oh, you can do too. Ghana there, as a Ghana in the world, there's nothing stopping you. The sky is
Oh
only
yeah,
the
yeah.
sky. The sky is the limit. So if you want to be this and be that, it will surprise you that maybe some years to come, I would want to add this one to mine. And some years to come, I would want to add it. And if I'm adding, I'll just start from level 3. I'll see, I'll see prof and start from level 300. And
In
then I'll
fact,
add it.
in fact, in fact, even in outside world, even medicine, there are people who are doing doctor of medicine and at the same time they are doing bachelor of law, LLB, or doctor of juris doctor
But
at the same time.
but professor, what are you? Are you not a lawyer? Are you not a are you not
Yes,
an accountant?
yes, that
So
is it.
it's possible. There's nothing
They do the
stopping you, my
same thing.
brother. There's nothing stops you. And as I said, Prof's portfolio makes me know that there's nothing impossible. Eh? So please,
Wow,
it goes
wow,
on and on. It's
interesting.
possible to
So,
do anything. So normally what happens is that they look out for the transcripts. They look out for what you have done. So when they see the transcript, okay, you have not done this, you have not done that. Do some prerequisites, then you can do this one. Do you understand? Maybe they want chemistry. They want this, they want this. Okay, do chemistry as some 15 courses or some 15 weeks course, pass it, then come and do this program. That is how it's normally done. So it's possible. Okay.
wow, interesting. So, one can be a naturopathic cardiologist and a conventional cardiologist. Wow, interesting.
Yes, that one is a plus to you. The personality is a plus. So whatever you are passing, if it's not working here, it will work there. And if you are a pastor too, then it means it is a whole thing. If it's not working, then if all three does not work, then you know that God will call the person.
You see, let me give you one. You see, Medimosis.
Yeah, maybe
Medimosis
Moses.
is a medical doctor and did his master's in pharmacognosy.
Uh-huh.
You see, that's why yes, he's practicing both conventional medicine and
He
herbal
practiced
medicine.
he practiced the two. I had two clients of mine. One client of
Yes,
mine, prostate CA, he went to Medimosis. He came, I think last week he came to me that he went to Medimosis. Yeah. Yeah.
yes.
So the thing there, I mean, so let's continue. So between internal medicine and family medicine, we also have one we call the family medicine. So aside the internal medicine is more like the adults treating them when the patient comes to the hospital and those ones. Now when you talk about the family medicine, it comes from family. So treating a whole family as a whole. This one is more of reading. So I wouldn't want to worry our heads on that. So the family medicine treats all ages. It treats the children, treats adult, treats elderly. So we have the the family medicine practitioner. Then we have the the internal medicine practitioners. They are all there. The scope is mostly the family medicine covers a broad range, including pediatrics, gynecology, minor surgical procedures. Then that of the internal medicine, as I said, focuses mainly on the what? On the internal organs. So that is what you are going to look at. That's what we are going to look at. So with the internal medicine, you are going to get a deep understanding of the chronic conditions. like the kidney disease, the liver disease, the prostate disease, the CVA, the stroke. We are going to learn about the pathophysiology and how it comes about, so that you would appreciate it and you wouldn't, give medication by just giving like that. You want to know, you would know the mechanism of action of how the medication you are going to give is going to work, and you want to know why to even give the medication and what the medication is doing. And as part of your course, you are going to, you would know some of the orthodox medications, so that if the patient comes and, there are some cases that the BPs are so high or something, for instance, if it's a hypertensive and it's so high, and you will have to bring in some initial treatment of the orthodox so that it comes down. Then you can either refer the patient, or you can make the patient come for a review and convert the patient on naturopathic medications. You will study all those ones because you need to know all the two so that you can work with the two. Often hospital based, but can also work in clinics. So that's the internal medicine. It will surprise you that when you are done with this course, you can set up a facility, a health facility, and run the hospital aspects and add run the orthodox aspect and add the naturopathy. So those of us who have facilities, you can even expand and add. It's all about certification. Ghana is all about certification. So please, I'm at a meeting. I'll call you back. All right. So you can set up a facility and add it and do the two, because now you have knowledge about them. Even if you are not going to, do extensive cases, you can manage. You can manage. How do you call it? Some minor cases, because now you have the two knowledge. It's good. Prof is around. They were asking about clinicals, and I'm sure it's part of the plan, right? When they go on vacations, right?
Yes. There's the whole 1 year clinicals at the General Hospital. So.
Okay.
Yes.
Okay. So internists can further their skills into cardiology, gastroenterology, nephrology. So just like we're saying, you as a naturopath, you can also specialize into those areas. So we are talking about when we talk about good medical practice. I added this one because it's very key for us to know. So here we are practicing medicine because we are learning internal medicine. When you meet Prof, you learn naturopathy. So you are adding the two. So you are saying that, and it runs through it. Good medical practice, good naturopathic practice. That is, let's take it that way. Refers to ethical, professional, and clinical standards required for physicians to deliver high quality care. These guidelines ensure patient safety, professionalism, and effective healthcare delivery. Please let's note this refers to ethical, professional, and clinical standards required for physicians to deliver. So we call something medical ethics. As a naturopathist, you'll have to go by them. We are going to learn them as a can. You have to be very professional as well. And you have to go with standards. There should be standards. I'm sure you know the standards now. You have been taught. There are standards. You have to know the standards. That maybe this drug, this condition, this is what we do. This condition, this is what we do. When the patient comes with this is what we do. I'm going to teach you some of them in medical practice too. So you have to follow standards and you have to be current. Okay, we have old ways of doing certain things. Now that you are enlightened, you have to go you have to move with the times. Okay, Mr. Amevoji, your Mr. Amevoji,
Hello.
you're making noise. So these guidelines ensure patient safety, professionalism, and effective healthcare delivery. So when you follow them, these are what you are going to meet. So components of what? Good medical practice, patient-centered care. We are looking at what? patient-centered care. When we say patient-centered care, we are saying that your focus should be on the patient, the client that is coming. The cost is not we don't see them as customers, we see them as clients. You understand? When we used to call them, we used to say patients, but now we say clients. Why do we say client? Because when we say patients, it looks like they come, you treat them, and they go. You understand? But now client is somebody you have a connection. When you say client in the business field, when we say client, it means that somebody you are having an interaction with, or you have somebody you have a deal with, or somebody who normally comes to you to buy, and normally so that is what we're talking about. So we see them as what? Clients now. So we say treating patient with respect, dignity, and empathy. That is one thing that we need to note, that we are going to treat as a good medical practice. You have to respect every patient. So as I made you know, the class is going to be a discussion class because all of us are practicing. All of us are almost all of us are practicing. So as we are all practicing, that means that if I'm talking and you have a case study or one instance you want to share, I would give that. But if it's too plenty, we'll shift it to question time. So respect all patients with dignity and empathy. You have to show empathy for patients. There are some of them who will come and they will be behaving some way. Some of them, they come in a very weird state. Some of them too are very annoying. You have to what? You have to have heart, take heart, and see them accordingly. And respect too. You have to respect all patients. Don't look at their dressing, or don't look at their pedigree, and respect them. Understand? So all patients need to be respected accordingly. Then treat them with some kind of dignity. Then involving patients in shared decision making about their health. You don't just pour medications on patients without, having an interaction with them. You understand? Decision making. Some of the drugs that you write for them, some medication that you give to them, maybe their finances are not good. You wouldn't want you would want to ask and know the patient's finances. Maybe there are other options that can do the same job but are less expensive. You want to give that one to the patient. You understand? So, and also you need to seek consent of patient in whatever that you are doing for them. Okay, that maybe you have to do a procedure for a patient. You have to do an exam. For instance, this afternoon I had to do a DRE for one client. So if you don't, those who don't know DRE is a digital rectal examination, whereby you will have to insert your hand into the patient's anus for male. To check for this woman was having how do you call it? Was suffering from piles. The way she was manifesting was suffering from piles. So I had to, hemorrhoids. So I had to go and see the size and how it is, and also to look out for any other abnormalities in the rectum. So I did a DRE for this patient. So you have to seek consent of the patient. You understand? Some patients too, even if you are doing examination and you are exposing the patient, you have to seek consent of the patient. It's all part of the patient-centered care. Everything is about the patient. Nothing. Unless it becomes about you, unless if the patient wants to go the other way around and tend to molest you or tend to harass you or something like that. That one you have to raise an alarm on that. But aside that, all other things should be about the patient, and you should also have some love for the patient. Let's treat the patients as our own family. Okay, some of us sometimes the way we treat some patients when our family members come to the facility is different from the way we treat some patients. It's not going to be like that now. When we are talking about patient-centered care, treat the patient as yourself. Then also, some of us also have this instance of putting fear into the patient. There are clinicians who do that. They put fear into the patient. I've had instances whereby some patients will come to you and they'll be like, the doctor says, it's not even naturopathic doctors. It's, our people. They will come and they will be like, doctor said this, if you don't do this, you die. If you don't, hey, it's not easy. Now I was like, now some doctors are even pastors. Yes. So we try to allay fear in the patients. Then when we end the slide, I will take some observations from you. Then clinical competence, staying updated with current medical guidelines, best practices, and research. So as a naturopathist, as a medical student, as an internist, right now you are medical students, you are naturopathist, you are internist. Whatever you are learning now, that is what you are. You have to be what? Abreast with current states. So, now that you guys, I'm teaching you this, when we have some, how do you call it? We normally have CPDs, continuous professional studies programs. I'll be putting them in your page. You can be joining as well so that you learn. Because every now and then I'm learning. We are learning. We have this year we're going to run them because at the end of the year, I don't know if you have that. Maybe it's yet to come. Prof, do they have that CPD something? Maybe it's yet to come. You are now preparing on that, right?
Yeah, we do as part of their license registration.
Exactly, that's what I mean. So as me myself, as part of our license registration, you have to join CPD programs. So I'll be putting it in your page. So once as you are learning, so that you also learn from there as well. So that you keep yourself abreast with current times. Yeah. Applying evidence-based medicine in diagnosis and treatment. So as a naturopathist, now you have to be what? To be requesting for labs. You don't treat blindly. Okay, you don't do blind treatment. You don't perceive. You don't. No. Fine. Maybe your history can point to something, but if there are investigations that will support it, please do them. So we'll be learning as we learn the conditions. We'll be learning their investigations as well, so that you can request them. For instance, that woman that came to me for the DRE to be done, I requested for an endoscopy to go and take an investigation that is done to visualize the anal area, the anus, and a part of the rectum, to see whether there are any bruising, any growth, anything at all. He could have also done a colonoscopy to check the colon down to the rectum. So these are some of the investigations that you want to do, so that at least, even if the person is not, couldn't finalize uh, his treatment at your end and has to come to the medical side, you will have done some investigations. Anyone who sees it will know that yes, the person went to a qualified person and not any other person. Do you get what I'm saying? Developing strong clinical reasoning skills. As you are going to practice, you are going to be learning along the line, so that when cases come, you don't just treat, you have to discuss it. We medical personnel, we do what? We do discuss cases. Sometimes when I'm seeing a case I don't understand, I have senior colleagues I'll call. I have bosses, specialists I'll call to discuss with them. You also, as you have cases like this, you have special senior colleagues, prof and other senior naturopaths are there that you can call. So it shouldn't be you alone doing everything. Okay, medicine and now naturopathy, it's broad. So it's always best if you discuss cases. So you should have that. That's free way of discussing cases. You have to discuss your cases. You saw a condition. Okay, let's do this. Let's do this. Let's do that. Okay, then we go on. All for the betterment of what? Of the patient. Ethical conduct, maintaining honesty and integrity in patient care. So you don't lie about, maybe you gave this condition and the patient died. You gave this drug and the patient died. Then you lied about it that you didn't give. The next time you cure another patient. So in medicine, we don't lie. Whatever that you gave, you might think that maybe that is not the cause, but maybe that drug has interacted with another. So we don't lie. Honesty and integrity in patient care, whatever that you give to the patient, and also you need to explain to the patient in whatever everything that you are doing for the patient. Some patients will tell you that, it's still about the consent. There's a patient who will tell you that I will not take this drug. Don't give it to them. Patient's rights is the best. You can explain to them, but if the patient does not give consent, don't give it to them. Because if you give it to the patient and the patient passes on, there is medical legal issues, and you face it clearly. Now with the medical legal issues, when they are charging or they are fining, they fine in millions, 3 million Ghana cedi, 2 million Ghana cedi, 1 million. That is it. So if you want to break down your whole facility for a medical legal issue, that is your own issue. Then we talk about that is our informing consent and treatment procedure. I've talked about that already. Confidentiality and privacy. Yes. So for every procedure you're going to do, you have to, you have to ensure privacy. Then also, your patients will always believe in you. Now that you have become doctors, you are sitting in your consulting room, people will come. It is only this profession that someone will come and tell you anything, almost everything about his family or everything about himself. Will even lie down for you to expose a private parts just because you are a doctor. That is the only profession that anybody will come and do that, except that maybe the person's spouse. Other than that, you are even now, people don't even allow themselves or pastors to do that again. But for doctors, they will allow. So you have to be what? You have to keep your mouth shut. Whatever that you see, you keep your mouth shut. And it should stay between you and your patient. Do you understand? Let me see the thumbs up if you understand. It should be between you and your patient. So you have to keep your mouth shut. In 3 years, say, oh, yeah, doctor, I also yeah, Oma Wanoye Drew. I remember once my auntie told me about an auntie, one of the aunties who had HIV/AIDS, and almost they are 10 siblings, but none of them know. But me being a doctor, she has told me. Nobody knows in the family. I think there are only 2 people who know in the family. The rest don't know. And sometimes they tend to bewitch the woman, the way she looks and things. But it's because she has HIV/AIDS. She has HIV, and nobody knows. And when I got to know about it, even if there is a cutlass or a knife at my neck, I wouldn't tell anybody until the woman says I should tell her. And she even doesn't know that I know. Someone told me because she was not well, and I asked that they bring her to me for me to see her. Then she made me know her medical history. So if now I know her medical history and she be my auntie, I cannot go and tell my mother. Do you understand? Do you understand? So that is confidentiality. That is confidentiality. So patient's confidentiality is something you cannot joke with at all. Then let me end. I think I wanted to end those ones so that I will take your So let's look at communication skills. Clear and effective communication with patients, families, and colleagues. Yeah, so you have to communicate with the patient, whatever procedure you're going to do to them. When you do lab investigations for them, we have this whereby someone will go to the hospital, they tell you that what happened, then what did they treat you for? They will be like, oh, the doctor did not tell me. We have that incident a lot. So we have to communicate to our patients on whatever we do for them. Families and colleagues, patient families and their colleagues. Sometimes you bring a patient to the hospital and the families want to hear something from the doctor, and the doctor doesn't want to avail it. Yes, there's a way we go about it. You cannot just tell anybody at all, but you look for the close relatives. Maybe the father, the mother, the wife. They are close relatives. Or the children. And if it's something that you can easily tell the relative, you have to tell them. There are some which are also confidential for the patient. So you keep those ones. You get a medical term to tell them, and then you keep those ones confidential to the patient. So you being a medical a practitioner or a naturopathist, it's a lot. So you have to go, by that. Active listening to and understand patient concerns and expectations. So you need to understand the patient, their concerns. Some people come to the hospital and they have what they want you to do for them in mind already before they came to you. Okay, so listen to your patients. Sometimes listening is also part of the. Some patients come and they will start with a story. If you cut them short, the vital informations will not come out. So you let them talk, but you realize that they are talking too much. What you do is that you tell them that. So what are the main reasons or main problems in what you are telling me, and you get them out. Avoid using medical jargons when explaining conditions. Like now, you are going to learn a lot of medical jargons. So it is not when you have a patient that you'll be using medical jargons, hypertension, hypermetropia, menorrhagia, hyperglycemia, diabetes mellitus, myocardial infarction. You see, the patients will just be looking at you and they will say, "This doctor, what are you saying?" So you don't use medical jargons for your patients. You have to come down to their level so that they will be able to understand you. Uh-huh. Yeah. Then let's okay, so still on the components of good medical practice, professionalism, demonstrating accountability, reliability, and respect in medical practice. Accountability. You have to account to the patient in whatever that they do. Patient comes to your facility, he pays for this, he pays for that, he pays for that, and still goes home with a very big bill, a very huge bill. Whatever that you do for them, if you are billing them, make it clear to them that this is the amount. Can you afford? Should I do it for you? And do not let patients leave your facility and feel that you have duped them, or you are using your facility as a means of extortion. You understand? Reliability. You have to be reliable. Patients come, they come to you, they tell you their issues, and you make them know that, make them feel that yes, they can confide in you. You understand? Respect your patient, adhering to professional codes and conduct. Yes, you have your professional codes, naturopathic codes, and all those ones. You have to adhere to them. Avoid conflicts of interest that may affect patient's care. Yes, no, avoid these conflicts of interest. Then sometimes certain things that you do, you realize that you'll feel that you are benefiting more from it. Please dissociate yourself from it. Don't make the patient feel that you are extorting them or you are making money out of them. Fine, you are providing services and they are paying for it, but they shouldn't be so out there like that. Patient safety and quality improvement, minimizing medical errors by following proper protocols, reporting adverse events and unsafe practice, engaging in continuous medical evaluation, medical education and improvement initiatives. Like I said, should always be abreasting yourself medically uh, on your as we become naturopathic doctors. So I think we'll end this one here on general medical practice. If you have any additions or any questions that you can ask before we continue with the 10 the principles of medicine, then we'll end it. You are left with just a few slides. Any question, any additions, any scenarios you want to add? Yes, anybody at all is free to ask. Anybody at all? Any additions? Anything you want to ask? Any question at all? Any scenario? Is Prof around or is gone? Okay. Yeah, Madam Olumide.
Yes, yes, Doc. Thank you so much for giving me the opportunity.
Yeah.
There was a situation, Reese, that I'm dealing with that where a patient is seeing an oncologist, and one of my team members who is naturopath has a different approach than what the biomedical practitioner is doing. How would that be handled? Because of the ethics and the principles of respecting one's colleagues and the choices that the patient has made, the naturopath has decided to hold back and wait until the patient asks for information about that approach. What do you think?
Okay, so that is it. So that's a great question there. So this one, it looks more like you see, if are they all in the same facility? Are they all in the same facility?
No, there are different facilities.
Oh, okay.
Yes, and the
Oh, and
naturopath is a friend of the patient who's
okay.
supporting her, but
Oh,
it's a
okay.
challenge.
Okay. So this one, it lies on the patient, okay. But then the naturopath can also suggest to the medical practitioner that you want to also do the naturopathic part, okay. You want to also do the naturopath aspects. I mean, all for the betterment of the patient. So with this one like this, it is the patient who will have to, I mean, request that he wants to try an alternative. The patient has their
Right.
right. The patient has their right to try for alternative or healthcare. So they want to go
Yes.
and try naturopathy and come back for their conditions. You get it?
Yes.
So that
Yes.
one involves the patient to do that.
But it all doesn't it also depend on the biomedical willingness to listen to the naturopath, because
Yeah.
sometimes relationship is not there.
Yes.
In this case,
So
the relationship is not there. So ethically or morally, it puts the naturopath in a difficult position, doesn't it?
yeah, it will actually do that. It will actually put him in that position. But then, like I said, everything lies on the patient. You understand? The naturopath cannot just go to the biomedical and tell him that, hey boy, I want to take over. You get that?
Yes,
But then
yes.
the patient can always back out. The patient can always opt for. The patient has the right to opt for an alternative medical care, alternative care. You understand?
Yes,
So the patient will
yes,
have to be the one to opt for an alternative care and go and see the naturopath.
yes,
You
yes,
understand? Because
yes,
they are in their discrete facilities. This one is in his own
right,
facility. This one is his own facility. You cannot just
right,
move to your facility and say, "Give me the patient. Let me give him naturopathic medicine." No, it is the patient
yes,
who will have to what give an option. So what the naturopath will do is that he can suggest to the patient that he has also another remedy. He has, I
yes,
mean, possible remedies for his condition, and so
mhm,
then the patient will do what the patient would request for what alternative what
yes,
healthcare.
right,
That one is
right,
done. We have patients who will tell you that, okay, I want to try herbal medications and see. And
mhm,
that's the patient's right.
right.
Yeah. So that's it.
So I would like to also comment, and this will be for further discussion, the role that the family has in these decision making. Because the family, when you are sick, the family is the one that will help to carry you. And sometimes it is the family that puts pressure on you to go in a particular direction.
Exactly. So it means
Yeah.
that for this one, it means that a lot of people will have to come into play, and a lot of education will have to come into play on the part of the naturopathist to the patient and the relative and the family.
Yes.
Yeah.
Yes.
Yeah.
Okay. Thank you. Thank you
You're
so
welcome.
much.
You're welcome, madam.
All right, Doc.
Uh,
Doc, please.
Hello, Doc.
Can I say something?
Hello,
yeah,
Doc.
Yes, Doc.
yes.
Can I say
My
something?
hand is up.
All right. So,
Okay, I'll be calling. I'm
a
calling
little
now.
that I want to add up.
Please,
All
please
right.
wait. I'll be calling you. Don't worry, I'll call you. So,
Okay.
Mr. Ame Vodri,
Yeah, thank you very much, Doc. Mine has to do with professionalism. As naturopaths, we've learned that if somebody is placed on a conventional drug for a longer period, and you meet such a client, you don't take him off his medication all of a sudden. You study about the medication that is being administered and also know what to do. But there are cases you meet some of these clients and they tell you, I'm fed up with the orthodox or the conventional drugs, so I don't want to use them again. What do you do as a professional? Thank you.
Okay, that's fine. So now you have come to know about it. You see, when clients tell you that I'm fed up with it, they don't want to go again. You wouldn't want to force the patient. The patient wants an alternative. That is why the patient came to you. Do you understand? So you give the patient the alternative, and let's see the results. Okay, you don't just say that, hey, go back to that. No, the patient wants an alternative. He feels that he's fed up with it. Perhaps maybe he has not got enough knowledge, he has not got enough education about that one. He feels that maybe perhaps he feels that there are a lot of side effects, and so he feels that maybe it is not doing him anything, it is not causing any harm, and he feels that there is a lot of side effects. So you can do your education that he might want to continue.
Apology, please kindly mute your mic,
Let him
please.
mute. So you can do your education that he might want to continue. But if he insists that he want to stop and go into naturopathic medications, why not? It's also another option. You understand? There are some people who are not on the orthodox drug, they are doing well on naturopathic medications. So you don't make the patient, you don't take the patient back. No, you make the patient go for the option and continue to check for the outcome. You understand? Then we look out for the outcome because in the end, we are looking out for the outcome. Is it making the if particularly BP and sugar, is it making the BP and the sugar better, or it is making it worse? So you make the patient know. So normally we make them do a BP profile and a sugar profile, so that we'll know that, I mean, while you started the naturopathic drug, these are the readings. When you are on the drug, when you were on the orthodox routes, these are the readings. So you compare the two. The patient will know. You understand? So you don't just
Yes,
you don't
please.
worry yourself. Let them know. Let's just leave the patient right for them. Ask them, which one do you want? Okay, this is what you want. Fine. These are the pros and cons of this. These are the pros and cons of this. As you are on the naturopathic drug, we are going to be checking your BP. We are going to be checking your sugar to see how better it is becoming, or to see whether it's getting worse. So alternative medicine is always an option for a patient. The patient has the right for alternative medicine. Do we get it?
Yes, please.
All right. Are you answered now?
Yeah, my difficulty has to do with taking him off the
No, no,
conventional
no. It's
drug.
not about. No, yes, it's about when you say you are taking him off. Fine. If you have the patient say he doesn't want it again, so what do? Or person also
Okay,
you have to stop. So you just make him
okay,
stop. Then you introduce your own. Then let's see the outcome. If it's not getting better, he will know that no, he has to go back to this one. Maybe even your own will get it better. You understand?
yes,
So
please.
yes, so that is it. Ingrid, love,
Thank you very much.
you're welcome, my brother.
Yes, thank
Ingrid,
you so much. Yes, thank you so much. I really appreciate the discussions going on. It exposes the experiences and helps us also to apply knowledge to situations that come. So I would like to share some experiences that I've had, and to
great,
also say that
great.
in my experience, information is key. It's difficult because of how the so-called conventional doctors are trained. They're trained to be an authority figure generally. So people
Okay,
usually see them as, as people who should be obeyed. And perhaps not in I'm not knocking that. However, it makes it difficult for anybody else, whether you're a naturopath or anybody else, to say anything that is not what the doctor says. I had that experience with my mother. I looked at the last medicine she was given, and the first side effect was death. That was the first side effect. And I questioned the doctor about it, and he just pretended like he didn't know what I was talking about. And as I said, that is what, after my mother's death, shortly after that, I set on this path. So I had an experience recently with a friend of mine with her husband. He had been on a particular medication for 10 years. And when she told, I didn't know before, but we were just in conversation, she told me. And I said to her to try a particular thing, natural thing. And 2 days later, 2 days later, she called me back and she said she cannot believe the medication he had been taking for 10 years, which actually I guess was just managing the situation. But she said he was still experiencing pain and all of that throughout the 10 years. Well, 2 days later, 2 days later. So because we were friends, she was willing to try, and he was in pain, so he was willing to try. But I'm just saying to Madame Olu before, giving information is key. Let the patient get that information, because I have another lawyer friend of mine who passed away last year. She, because I guess she's a lawyer, and professionals like that feel that they know more information, or they won't believe you if you're not a doctor. She had cancer, and she flew. She's from Nigeria. She flew to she moved to the UK because she had family there also, and she spent 2 years. 2 years. And the final time when she was just now wanting to try something, well, to listen to what other people were saying, naturopaths, she passed away. And it was just before she finally decided to try. But before, she was just telling us, well, we're not doctors, so this, that, and the other. But if you give information, give people information. See, don't push them. Just give them the information of people who have done this, and this is what worked. And also give them the information of doing something for 10 years and nothing changed. I mean, that's a to me that's a no-brainer. You don't have to think about that. If something changes in a particular shorter period of time, then why not try? And I could go on with many stories. One friend, one last one friend who was going and scheduled for an operation for cholesterol. And I said to her, I said, I'm not telling you, do not change that appointment, because it was difficult to get the appointment. I said, don't change it. But I told her, try this. It was like 3 weeks before the operation. And by the time she did, and by the time she went in for the operation, the doctor said she didn't need it again. So I'm just saying, give people information, because you can't beat what is in front of your eyes. And when people are sick, it's hard for them to take what you say, especially when you're not a doctor, in their eyes.
All
And
right.
especially when another doctor, in their eyes, who they, have authority, they fall under, they are telling them something else. So thank you. Thank you for the opportunity to,
Yeah,
to
thank you for the experience too. I mean, it's true. If you are telling somebody something and he's not getting, get scenarios for the person. Okay, sometimes it's best to, I mean, get scenarios. I mean, get how do you call it? We say reviews for the person, and that one too can help.
yes, yes.
Yeah. Kadish, Kadish.
Yes, yes. Greetings, Doc. I'm very
Yeah,
intrigued. Very
yeah.
intrigued.
Let's have.
Thank you. Yes, you spoke about the DRE, and I'm familiar with it. Done commonly in males, but you spoke of it in females. So I need to know if we will be going further into this in our classes.
Oh, okay, oh, okay. We do it in males and we do it in females. Anyone can do
Yes,
a DRE. For, that's why I was
yes,
saying that for the female, I was looking out for. I mean, it's not really the diagnostic. I mean, uh, treatment for it, or it's not a test for it. It's not a diagnostic test for it. But I just wanted to do it manually to see whether it is really present. She was actually having hemorrhoids,
Okay.
anal hemorrhoids.
Okay, because I really Googled it a while ago to see what it is really, and it said that they examined for pelvic
For
in the pelvic
for
cavity for
for
other
prostate.
issues, but for piles, that one is kind of new and
Yeah, for
sensitive.
prostates we do that. We do that for prostate for males, right? Did you see that one too?
Yes, yes.
Yes, and that of yes, women too. We do that, but I mean, as I said, that is not. I mean, it's not really the diagnostic like DRE for prostate in males. For women, it's not really. I mean, the classical diagnostic tool. Okay, but in the manual, normally we do it. I mean, in practice.
Okay,
Yeah,
thanks.
healing hands, healing hands.
All right, sir. Good evening.
Yeah.
Yeah, so this is Ambrose.
All right,
Yeah, I wanted
sir.
to say something about what Kadesh was talking about. That one thing is, as much as we are networking, it is going to help us now because at first, what she was saying mostly goes around. But now that we are networking with the medical doctors, I believe that if you have an issue or you have a case or a client and you are not able to sort out 100%, definitely you know from your second, third, fifth, sixth visits of the patient, you're going to know. So quickly, just as we are doing, we'll give you referrals to the medical doctors. The same way, you also have to now connect with us. You said something from the beginning, and I was very happy that as we are pursuing this course, the more we do it, the more we get good doctors, like alternative doctors around, not just like any other uh, unprofessional doctor that will just give anything in terms of natural medicine or whatever. So now that this is happening, I believe we should do that because as part of networking, that is why now I'm working with one Dr. Kunsis, and we are doing so marvelous. I'm a chiropractor, he's an acupuncturist, and then with these two combinations, it's doing magic. It's doing miracle because sometimes there are certain things that a chiropractor would do. You get to a point you need something else, but if you don't know anyone to recommend you just have to leave the person or you just keep trying. The same way with the conventional side as well. So even within ourselves, if you have a patient that you are treating for 3 months, 5 months, 6 months, 1 year, and you are happy that you have a client as long as 6 months, 1 year, and you are happy that you have such a patient, I think you should be ashamed because you should clear off you be in a space. If you think that the situation is not changing, you just refer as soon as possible. And when we come to dynamic in our hospital, we do that a lot. If it comes, we take you through, we come for your review, 1, 2, 3, 4, and we realize that nothing is changing upon all the modes that we've tried and it's not working. We just have to refer to either Equals Training Hospital or Asinfosi Hospital or any of the big hospitals so that we take it up from there. So we shouldn't also keep them just like the conventional people shouldn't also keep them. We should just work hand in hand when it comes to them. Thank
All right, thank you very much. I mean, you have enlightened us a lot on something. Yes. So, like I was saying, uh, medicine is not does not lie in the minds of one person, and medicine is broad, dynamic. So you don't have all the knowledge. You cannot know all the knowledge in medicine. So referral system, asking your colleagues. You can even ask now that we are connected. Like you said, we are connecting. You should be connecting. I mean, you have a particular case that you are studying or you are seeing. There's a condition. You have seen 1, 2, 3. You are seeing that still you are not making any progress. Don't continue. Refer the patient. You can refer to a general practitioner. You can refer to a medical practitioner. You can discuss with your fellow colleague. You understand? Some people they will keep on giving. But now you know the right thing. Now you guys, you are well enlightened. You have got a knowledge. You have got education about this. So you know how you're going to talk about when you talk about referral system. You understand now. So to the very best that you do it for the safety and for the betterment of what of the patient. So that's it. That's a nice one. I put up Ashanti. I'm Otep.
Yeah, give thanks that. Can you hear me?
Yeah, I can hear you.
Excellent. All right, I like to look into a case scenario, say, for instance, based on some cultural taboos. Right now, we looking into the rectum examination, right? So for instance, the practitioner doesn't have any device, and based on the cultural taboos, the insertion of finger, it's a no, and and how do you navigate around that situation?
Okay, so that is, I mean, that is in your. If I'm getting you correct, you're saying that it's taboo in your country, right?
Now I'm just giving you a case scenario.
Yes, I think that's what he's saying.
He's saying that he's saying, what is he saying?
It's taboo in Jamaica. You can't go to any man in Jamaica and say you're going to put your hand up his bottom.
Yeah,
Won't happen.
I mean, it's not well practiced everywhere. I mean, I'm in Ghana, and as part of even with prostate diseases, okay, as part of the examination, the examinations ends with a DRE. That is in Ghanaian practice. You understand that? So that's what I'm saying, that you have to seek consent. Maybe the person is not a Ghanaian. He doesn't want that. You don't. You can't do that to anyone at all.
So what I think he's asking is what are the ways around it? Because I think in Arab
Oh
countries
yeah,
as
yeah,
well.
yeah, yeah. Okay. So what there are other ways around it. You can just make the patient go do a colonoscopy. You can make the patient go do an endoscopy. Yeah, just go and take a photograph of it. That one you're not going to put their hand. It's going to be a tube inserted showing with a graphical. I mean, showing on a screen to show whatever that is there. So that one is allowed. Yeah. I actually gave her a request to go and do an endoscopy for me. Possibly also to add up a colonoscopy to check the colons down to the rectum, then to the anus area. Yeah, so it's allowed. Yeah. I think the questions are done, right? All right. Yeah. So let's finalize it. So 10 golden rules of good medical practice. So this one you read them. Okay, practice with kindness, ethics, and honesty. Upgrade professional knowledge and counsel. It's all about what we've talked about. Okay, maintain doctor-patient confidentiality. So please take note of this. Be a partner in promoting global health. Avoid publicity, self-promotion, and abuse of position. Be conscious of costs of healthcare. Maintain good working relationship with colleagues. These ones are something that you need to read about. Principles of medicine. So we're talking about the principles of medicine. We're talking about we've talked about already. We have one, beneficence, non-malfeasance, autonomy, justice as is fair and equitable care, evidence-based practice, holistic approach to medicine. Yeah, I think we'll end it here. So let's look at it. So when we talk about these ones are called the medical ethics. Okay, have you done medical ethics? Did you do medical ethics? Have you done medical ethics? Hello. Have you done ethics in medicine, medical ethics, or ethics in healthcare ethics? Did you
Yes,
do
sir. We
that
did
our
it in
course?
the first diploma, the first session, the diploma. I
Did
think it
you do
was
that
prof
as
that
a
took us
course?
through. Yes,
So you did autonomy, confidentiality, and all those ones. You did that. You did those ones.
yes, sir. We did that. Yeah,
Oh, then
it
that's
was
fine.
prof that took us through, and
Pardon
also
me.
some of the laws surrounding that. It was prof that took us through it. There was
Then
also
that's
some of the laws surrounding the practice itself.
exactly. Then that's fine. So beneficence is what? Do good to the patients. So we are just doing a recap. Do good to the patient. All that you are doing should be in the best interest of the patient. Okay, it should be in the best interest of the patient. Someone will be like, when I treat the patient and he's fine, the next time he will not be sick and come back again. Then you are a bad clinician. Okay, so everything should be in the interest of the patient to help the patient to improve the patient's health. Okay, whatever you are doing is to help improve the patient's health. Okay, whichever medication that need to be given, whichever vaccination that need to be given, whichever preventive medication that need to be given, IV infusion that need to be given, anything that you need to give the patient, whichever injection that need to be given to the patient, give it to the patient. So once the patient is able to, I mean, there is a means or there is a provision for it, do good to the patient. These are one of the medical principles. Then the second one is what? Non-malfeasance. Do no harm. Okay? Do no harm. So avoid unnecessary risk, harmful interventions, and medical errors. For instance, there's a condition, there's something that there's a procedure you want to do. You are not so abreast with it. You don't have enough knowledge about it. You understand? You don't have enough knowledge about it. Don't force yourself to do it when you don't have enough knowledge about it. You are doing harm. If you might cause more harm than good to the patient. You understand? Prescribing medications only when they are necessary. Okay, you don't write medications for the patient to keep or to medications that are not necessary. You just write for the patient to use. I mean, they are not the best. Okay, you have to make sure that the drug you are giving to the patient, you have researched to know about the side effects of the drug and everything. Like Ingrid was saying, to know about the side effects and everything, to know whether it's good for the patient, whether this patient's condition he can take this particular drug. This time around, the internet is always there. You understand? Anything that you want to give, you want to what? Even search about it. Even if you know, just search about it to know whether it's even having any side effect. And you should also ask the patient about their side effects. Some of them they know. Okay, ask them. And even sometimes you can even check the side effects and ask them whether they have anything like that. If they had those things, if they have those particular side effects, if you give the drug, it's going to worsen it. So you don't give. You understand? So also then with doing no harm to you, you balance the benefits with what? With the risk when making decision makings. When it comes to decision makings. So you realize that this patient tells you that he doesn't take blood. You understand? This patient doesn't take blood. Yes, you have to respect the patient confidentiality. But you have to respect the patient's consent. But then if it's a child who cannot consent for himself, and you don't want to do no harm, you might want to what? Give the patient blood to what? To help the patient survive, so that later that one can be sorted out. At that crucial moment, at that serious moment, you have to save the patient's life. You understand? autonomy, respect for patient rights. I've talked about it. Patient rights, they have rights about right to decision making, informed decision making about their health. A patient should be able to say that yes, I want to do this surgery, I don't want to do it. A patient should be able to say that yes, I will take this medication, I will not take this medication. A patient should be able to say that yes, I will do this procedure, I will not do this procedure. That is the patient right. You understand? You can. They should always give you the go ahead before you do anything for them. You also give them. Don't be hiding things from the patient, and you respect the patient as well. Then always, as I said, you should always seek consent of patient before doing anything for them. You should always seek consent of patient before doing anything for them. Then justice, fair and equitable, ensuring fair distribution of healthcare resources. Okay, don't be discriminative when patient you have a number of patients there. Don't be discriminative. It doesn't mean that don't do triaging. You call something triaging. Triaging is different from discrimination. Discrimination is that you see some people, everyone is fine, everyone is sitting down, then you call some people, then you see them. There's some people you tell them to come the next day, some people you tell them that they should wait for a while. Then you are picking some, you look at some of them, see someone who is, this person is beautiful, let me see this person. This person is well dressed, let me see this person. This person is wearing a nasty dress, let him wait, let him wait. You see all those ones are not, they are not fair. Maybe you say that, oh, this one is rich. Let me see the rich one, and let me see the let the poor one wait. No, we don't do that. In medical field, we don't do that. As a naturopathist, as a medical personnel, you cannot do that. You also have to what? Advocate for what? Health policies, interventions that will help with that would help to improve health. That would help to improve the health of your patient. Very, very important. Evidence-based practice. So let it be part of you that you have to do what? Investigations. Okay, you have to do investigations. A patient comes to be with you with chronic cough, serious coughing for a number of days, a number of years. You might want to do some investigations. A sputum for gene aspects. You can do a chest X-ray. You can do sputum for other cultures. You can do a full blood count. You can check the lungs. You understand? You can examine the patient. These are evidence based. You don't just treat blindly like that. Do a chest X-ray. Have a look at the chest X-ray. If you can't understand, you can send it to somebody. The person can interpret for you. Even now, you can put an X-ray online and you can get interpretation of it. AI is there. You can use it. So now, evidence-based medicine is something that we are not joking with. You shouldn't misdiagnose someone, or yes, even if you miss a diagnosis, you should not. Kill the patient just because of the fact that you didn't do any investigation. Do investigations to know what really the problem is. Evidence based. There should be an evidence of something. You understand? Avoid outdated or unproven treatments. Giving some medication. Some medications that are even some people they give medications that are outdated. Some people still use amodiaquine for malaria treatment as at now. Yes, amodiaquine has been stopped long time ago. Still, we use it although, but we don't use it more often like that. You understand? Now we use the artemether lumefantrine. Those are the current ones because we realize that the amodiaquine it has a lower threshold. The specificity is low, and a whole lot about it. But still, some people still use it. You have to be very current physician. You understand? Updated with treatment and all those ones. Then you have to undergo what? As I said, the CPD, so that you stay current, you stay abreast. Every now and then, you know the current trends. And you have to be researching about it. I mean, do research about anything that you are learning about, anything that you are treating about. Do research to know the current ones. You understand? The current treatment modalities. Holistic approach to medicine. considering, so you don't treat patients just like that. You treat them holistically. You focus on the spiritual aspect, on the physical aspect, on the mental aspect, on the financial aspect of the patient. You understand? That is holistic treatment: biological, psychological, social factors in patient care. You look at even the patient that you are treating. Does the patient have money to buy the drugs? The patient that you are treating for BP has broken up with the husband, is being beaten by the husband. You are giving BP medications, it will not go anywhere. This patient goes home and is going to be beaten by the husband again. The stress is still there. There is still stress. So you need to know all these ones and find ways and means of how to what to care for the patient holistically. You understand? So that is it. You need to know whether the patient even has a spiritual background. Sometimes spirituality, the patient's spirituality, that the person even believe that the drug you are giving to the person, it will even provide the healing. Yes, sometimes some people take the drug, they don't even believe that the drug will work, so it will not work. Sometimes our beliefs are also good, so spirituality is also part. The social, the family support. That the patient, if you have any family support, this patient who has a stroke, who is having a stroke, maybe he does not even have any relative, or the relative he stays with the wife or with the son, who leaves the patient and goes to work and does not have anybody to care for the person. So you need to know all these ones, so that if you have to invite the relative over and suggest that they get a care for this person, all these ones holistically you are caring for the patient and not just giving drugs. The good doctor is the one that cares holistically. You understand? And even now in the medical setting now, and even in the naturopathic setting, we are looking at what? Holistic care. So where holistic care is that we are looking at the patient needs psychotherapy, does the patient needs nutrition, does the patient need psychological care, does the patient need medical care, does the patient need naturopathic care. You understand? All these holistic. You need to look at all those ones. Treat the patient as a whole person, not just the disease. You understand? So treat the patient as a whole. Look at the patient's lifestyle and everything. The patient, this patient is sitting in front of you, has a high BP. This patient has a child who is a robber, who is an armed robber, who has been jailed, as a husband, who is a drunkard, who comes home and beats her, and this patient keeps on thinking. So he has this situation at hand. So if this patient is not able to find a way of managing this house situation, the BPs will never come down. You give your medications and the BPs will be running in the air. You understand? So that is it. So I think we'll end here. End our class here. I'll put this slide in the page for you. Then if there's any other question, you can ask while we end our class here. We'll meet next week, same time next week. And yes, within the week, whatever that I want you to do, the groups will be ready within the week. Whichever topic that you need to be discussing will be ready. The next topic for our next class will be ready by within the week. I'll put everything in your page. The slide will be shared in your page. Any other thing that you need will be given to you. And I think that's all. I wish you all the best in the week. If there's no other question, then I think we'll end it here. If there's any other question,
I
you
have a
can raise your
question,
hand.
sir.
Healing hands. Is your hand up?
Yes, sir. Yes,
Oh,
please. I
let's.
have a contribution. I have something to say.
All right,
All
let's
right.
have
So,
you.
as part of intermarketing or internetworking between us, um, a group of us has come together to form uh, a very strong bond of naturopaths that we connect and work within ourselves. Now we
Okay.
have individual specialties whereby some are chiropractors, some are acupuncturists, some have specialty when it comes to treating sore, like different. So we are deep roots group of naturopaths, and Prof is
Okay.
aware and he loves the group so much. Prof himself is part of the group, and some of us here. I think for now we are not many. We are about 12 in number. We are here to recruit other people who wanted to join us after the graduation because we want to set up one or two things very solid before they come. Now, what we do is just like the conventional side they do. We do what we call specialty appointments. So if whilst I'm in my center, let's say I have cases like hemorrhoids and I don't have treatment for that, instead of pushing the person away, I'll either connect the person to a group member or invite the group member. Now we say that okay, every Monday is for hemorrhoid clinic. So people with hemorrhoids should come every Monday. Now the second part or other part is that if let's say I'm in Kumasi and I have a patient that I've treated whose relative is in Accra, there's no need of that person or that patient or that client to come to Kumasi. We have a member in Kumasi or in Water region who can sort out that patient that we trust as long as he's a group member. So we have that, and
That
it's
is
really
that is
doing very well.
that is very excellent. Wow. Kudos, 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 kudos. Let me give you thumbs up. Let me give you thumbs up. Let me give you thumbs
Thank
up.
you,
Okay,
sir.
I want to add something to what my brother just said. This is Daniel Kumsin, CEO of Dynamic Herbal and
Yeah, that's a very
Medical.
good one. That's a very good one. So if the patient,
So,
I'm coming. So I'm coming. A minute.
okay,
So if the patient, you saw the patient is in Accra, and maybe the patient came to, let's say, Kumasi, and want to undergo naturopathic, you can refer the patient. Okay, go and see my colleague doctor in this hospital, right?
Yes, please.
yes,
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 please.
That's a good system.
The chairman of the group, yeah, the chairman of the group is the one who's trying to speak. That is Dr. Kumse.
Okay,
So you
let's
can also
let's hear
allow
him.
him to speak.
Let's hear him.
So it's good that we started practicing this kind of treatment. In fact, since we started at my hospital, of which Dr. Amos is a worker or is a working colleague at my hospital at Chukwuplaso. In fact, I am acupuncture practitioner, and Dr. Amos is a chiropractic practitioner. So we have combined these two treatments in my hospital. And I bet you, now the government, the municipal hospital of Chukwuplaso and Dumpanofin and the polyclinic around, they have got to have belief in us. Even today, we had a lot of referrals from the district hospital because they have got to know what we are doing, and we are not alone working. In fact, we have combined them. We are all working as one, as a one body. We go to them, we do referral to them, they give us referral. So is as you said first, is better we do special we start practicing specialties in our hospital. And let me say this one to you. Since we started doing this, we have a lot of patients because and when the patient visits our facility, we analyze it. Is the case for chiropractic practitioner or is the case for acupuncture practitioner or the patient need medicine? So we sit down and I bet you we are making name in our facility.
That's a
You know,
good one. That's a
our
good one. That's a good one. That's a good one.
so
Kudos,
we
kudos,
have,
kudos,
in
kudos.
fact, I think last week we have referral from Interbet. They have got to know what we are doing from Cape Coast. So they have also started giving us referral because we are also having a kind of treatment of which is also helping a lot.
Because the reason being is
So
that we all refer to you because the reason being is that most of our patients who come with osteoarthritis, lumbar spondylosis, osteopathies, osteomalacias, and all those ones, we only give them medications. But if you have these few
yes,
guys around, you are going to do the chiropathy and everything, it would be good. I mean,
acupuncture.
so that is it. So that's a very good one. That's a very good one, Charlie. Kudos, kudos. I respect you guys. Good, good, good.
So
Yeah.
we are still getting a competence. Those who have belief in themselves that oh, they can heal a patient. In fact, we don't just need anybody. We want and those who have believed, oh, I am special in this kind of treatment. So they all can come on board so that we form one team. And I think naturopathy will also, we can let the naturopathy
Yeah, you be
work.
out there. Yeah.
Yes. So that's
Any
what
Imhotep, is your hand up? Ashanti, is your hand up? Okay, I think it's the first one. So I think if there's no other, we'll call it a day.
Thank you, Doc. Have a blessed day, everybody.
Right.
Thank you all. God bless you all.
Thank you. Good evening.
Thank you. Bye.
All right. Bye
Thank
bye.
you. Bye.